Hello, I'm Jonathan Kay, reporting from Eular 2024 in Vienna, Austria. I'm going to talk about two posters that were presented at Eular. These are posters number 0451 and 0607, both of which come from the University Hospital Lausanne in Switzerland, the group of Thomas Hugel. During the COVID-19 pandemic, we faced the challenge of assessing patients with rheumatoid arthritis remotely. We switched from in-person visits to telehealth, and since rheumatoid arthritis is a disease that is largely assessed based on physical examination, we were challenged in ways to detect joint swelling as well as joint tenderness. Thomas Hugel and Marc Blanchard in his group and others have developed some digital applications for an iPhone, which allow patients to record their hands and give a sense of swelling or loss of motion. The first app is one called Detectra, which is one where the patient captures a real-world image of the second through fourth proximal interphalangeal joints. And because with swelling, the folds over the finger joint expand, and the ratio of the distance between these folds increases with swelling compared to no swelling, they're able to come up with a reasonably reliable way of detecting finger joint swelling, both worsening and improvement. They trained this model using a convolutional neural network on photographs of 1,783 proximal interphalangeal joints from patients with rheumatoid arthritis and an additional 151 proximal interphalangeal joints to come up with finger fold number and proximal interphalangeal joint diameters. They calculated a finger fold index as the ratio of the joint diameter to the mean pixel length of detected finger folds and came up with a reasonable correlation with the DAS28 CRP and swelling and pain on a single joint level. This may be a useful tool to use with remote patient monitoring or with telehealth visits when patients are unable to come into the office, either because of illness, pandemic, or distance. Another challenge is how does one detect function? And they came up with another digital application called Mephisto, which is looking at finger motion. It measures the angle of motion of flexion of the proximal interphalangeal and distal interphalangeal joints. And they ask patients to make a fist rapidly 5 times. And it captures, using an algorithm, the angle as well as the rate of motion. And patients who have increased pain and swelling will flex their finger joints more slowly, and those who improve can do it more rapidly. They found that the rate of swelling as well as the rate of flexion as well as the maximal flexion of metacarpophalangeal and proximal interphalangeal joints correlated with the HAQ-DI as well as the DAS28 CRP. So with these two applications, we're reasonably into being able to assess patients remotely using digital rheumatology. This will need to be borne out with further study, and additional applications will need to be developed to assess function and other aspects of the physical examination. But this is both interesting and promising for the future of rheumatology. For more information about this and other presentations at Eular 2024 in Vienna, go to rheumnow.com. I'm Jonathan Kay and look forward to seeing you again soon.